It's no big deal. I got it. That's me. Hello. What's going on? Who's with me on Instagram? I see you, Eddie, Steve, Jake. What's up, man? Right here, brother. It's so good to see you today. Thank you for, gosh, I think we're going to have those eggs in the morning. How's everybody doing? Who's with me over on YouTube, Facebook, Instagram, the places? Debbie from North Queensland. Hello. I hope you're doing okay. I hope you start to feel better. Katie, what's going on? Great to see you. D. Lynn, Grandma Mary. We got a good crew in here. Katie over on YouTube. Ivermectin question. I love it. Thank you. All right. What's up, R. Cook? What's up, guys? Great to see everybody. Hope everybody's well. We're taking questions here as well as here. So if you have a question for Dr. Rogers, we're going to get to every single one tonight. We missed the colostrum brand. So we are, I believe we found that. Katie, would you know the colostrum brand that we're talking about that Doc likes? Tom, what's going on? Great to see you. That's awesome. That is awesome. We got to get you to meet Doc, brother. Steve, what's going on, my man? I hope you're well. I'm so proud of you. Edna, hello. Great to see everybody. Let's see here. Let's real quick before Doc gets up here. I want to put this up if I can find it. And there we go. Who's watched this? Anybody watched the off-label uses of microdosing and microdosing of GLP-1s? Super cool episode. And I want to talk about it. We had a bunch of questions on Facebook today around microdosing, GLP-1s, as well as the off-label uses. If you have questions around that, put them in the comments. Thank you, Katie. Let's see. I'll put this up. Powder from Pure Velvet. Okay, so that's the colostrum. Is that the one Kelly's using, Katie? I'm almost assuming it is. Thank you for putting that in there. There you go. That's right, Tom. That's a great point. You know, some people prefer berberine versus a GLP-1. Definitely appreciate you watching the episode, and people are having so much success with berberine as well. Anybody like the video? Got anything out of it? Brandon, what's up, man? So good to see you, my NA brother. I hope you're doing wonderful tonight, man. Hope you're grilling out there in Topo Chodos. Lisa, hello. Connie Lynn, hello. Great to see you guys. Thank y'all for being here. Thank y'all for watching. If you have questions for Doc, put them in the comments. I see one from Katie on YouTube. Let's see if I'm missing any others. We're going to get to the colostrum thing. Thank you, Katie, for that. Let's see what else did real quick. We're starting to clip up this show a bit. We put this out in the weekly. If you're not signed up for Performance Weekly, you're missing out. We curate our best content from the week. There's a written form of the Common Sense MD episode, so you can kind of watch the episode while following along in a blog post. We pull out the key insights from the video of the Common Sense MD. It's about 11 minutes long. I like to use both of them. So I encourage everybody to be a part of Performance Weekly. If you're not, we talked about the blood type diet, which was featured on this show. I forget who asked that question, but we appreciate the topic. We got to dive in a bit on that. And then let's see here. Thank you, team. Real quick. Lisa, what's going on? Great to see you over there in Knoxville. I hope you're doing wonderful. Great question, Debbie. Carter, what's going on? Great to see you today. So good to see you. So good to see your parents. I hope they're with you. I hope they're around. Shout out to the Geglies. We love you. Great question, Edna. Ivy and JC with Ivy, what's going on? Great to see you. We got a whole crew in here tonight. Thank y'all for being with us tonight on this beautiful July evening. Roel, my week has been amazing. Had a wonderful July 4th holiday, and the week's gotten started just wonderfully. I got to see some of the crew in the Kingsport office today, which always makes my week great. So shout out to the Kingsport office. Let's see. April, what's going on? I need to get to the Knoxville office. It's great to see you in here. Moretta, Happy Life, what's up? Great to see you guys. I'm going to do my Instagram wave. All right. Doc is on his way. Rachel, what's going on? We got the whole family. I love it. I love it. Shout out to Wesley, Robbie, the whole crew. I hope y'all around the dinner table, in the living room, hanging out. I'm going to have a little dinner after this. Montana, what's going on? Great to see you. Hope you're doing wonderful. Let's see here. So good to see everybody on Instagram. Thank you guys for hanging out. If y'all have a question, I'm looking here as well. Best life I ever lived. I'm doing it right now. Shout out. Mama Bear. Thank you for being here. All right, we're taking questions. I see Doc is on his way. There he is. What's going on, man?
How are you?
Take a seat.
Thank you.
Take a seat. Come to my office.
Thank you. Am I late?
No, you're right on time, man.
Some of us have to work for a living.
How was the day?
It was a great day. Yeah. Had a great day.
We also do our little rundown of like how's everything today. My day was great. I got a little workout
all day.
A workout in after work. Yeah.
You pump iron?
I did it for Tom. Tom. Yeah.
You're getting some.
Yeah.
Bone doesn't flex, does it?
Roel, IG is live. Are we live? Can y'all make sure Roel confirm with me that you can see us? That's right, Katie. That's right. That and Freed.
Freed? Yeah.
That's the bomb. That's the bomb.
Yeah, I like it.
Okay, I'm gonna start this real quick. Check. We got this on the podcast as well. We're recording. I love that. Tom benched 400 today.
400.
400.
Good Lord. It's unbelievable. Congratulations. That's a good goal.
That is not what I was moving. I was moving some dumbbells.
That's awesome, Tom. Wow.
All right, let's see. I think we're getting some lighting. There we go. If you're new here, if you're new to the show, let me know. Let me know where you're at. Let me know where you're from. We'd love to learn more about you. Thank y'all for hanging out with us tonight. There we go. Thank you. We're doing a little camera adjustment. All right, let's see here. We're gonna get to the questions here. If y'all have a question for Doc, we're gonna get to everyone tonight. All right, thank you, team. Thank you. We're live here. We're gonna take questions. Start it. All right. Okay. I have to have a knee replacement in September. My father had a bad experience with a hip replacement, got several infections. I'm not having mine here. What things can I do to prepare and have a positive experience? I'm exercising and taking several vitamins. What's your thoughts on this?
Yeah, well, I'm sorry your father had a bad experience with a hip. Hip replacements are they go pretty well usually. It's pretty routine. As a matter of fact, a hip replacement.
Knee replacement.
I know, but I'm talking about hip replacements.
Okay.
Because it wasn't the infection in the hip.
Correct.
Yeah.
Correct. Thank you.
The hip replacement has been voted, I read this week, the most successful surgery out there.
No way.
Yeah. Hip replacements usually go very well. It's pretty easy to do a hip replacement and do well without a lot of physical therapy. Now, knee replacements, it's a little different ballgame. It's a little tougher, especially on the rehab's a lot harder. In the hips, you don't even have to do much rehab. There's two ways to go at a hip, anterior and posterior. The anterior way is the newer way, and probably the way, if I had to have a hip replaced, that's the way I'd want to go. Makes it a lot smoother. But as far as a knee goes, and again, there's options with knees as well. There's a lot of different ways they do it. They can do these really precise measurements. Sometimes they will even just do a medial part of your knee. And so there's a lot of little different partial. A lot of times they'll use a glue, almost like a concrete thing that they post it in there with. Sometimes they don't. So if you ever are not real comfortable with your surgeon, ask for a second opinion, get a couple more. And a lot of times it might have been bad luck with your father with having an infection. That's the one thing you don't want to get, especially with a joint replacement, is a post-op infection. Besides being in good shape and getting up soon afterwards, one thing that I would do personally, and I recommend all my patients to getting any kind of surgery do, is put an antibiotic called Bactroban inside your nose, belly button, for a couple of days before the surgery and after, because usually these, what we call nosocomial infections, don't really come from the hospital staff. They come from your own nose.
That's interesting.
Yeah, so it's a good practice to get some Bactroban, musopuricin is the generic name for it, ointment to rub on the inside of your nose before surgery and afterwards as well. A lot of surgeons routinely do this. But, look at the infection rate in the facility you're getting it, whether it be an outpatient or hospital setting. I'd prefer to get it personally at an outpatient place rather than inside a hospital, just because of the care. And you're not going to be there real long anyway. But it seems like the bad bugs float around the hospitals more. But get a second opinion if you're not comfortable with the first one, and hopefully you'll do well. Yeah, I'm sure you'll do well. But if you take vitamin C, vitamin D, B complex, you avoid going in there sick. If you have a recent viral infection, you may want to put it off, or any kind of nose or throat infection, put it off. But just talk to your surgeon at length about chances of infection, what their infection rates are. If you're a person that has recurrent MRSA, you definitely need to start using the Bactroban ointment. But
would you use that before or only after?
Before.
So use the Bactroban before.
Before, during, and after.
Okay.
I think that's a major thing you can do. So try that, and just talk to your surgeon and say, I'm concerned about this. What are other things that you're taking preventative measures with? Usually they operate in a very sterile environment, a laminar flow room. They're in these special suits when they do knees, especially, because you do not want to get a knee infection post-op. I've seen a few, and some people are more prone to them. Yeah. If you're one of those people that are prone to having staph infections, you really got to hit it. Maybe even take some prophylactic antibiotics and make your surgeon aware of that fact.
That's super interesting. I've heard you talk a little bit about the Bactroban for, surgeries or going into surgeries.
Definitely.
That's super interesting.
Probiotics. I hope you're taking a probiotic.
Yeah.
Make sure your gut's healthy.
And they're exercising as well, so they're getting in shape.
You'll do fine.
Yeah.
You'll do fine.
Thank you so much for that question. Came in through email, and I know Katie put it up here somewhere with the colostrum. Let's see, colostrum brand. Just so if I hope the listener is here with us live. But the colostrum brand we like is, did you see that?
Pure Velvet.
Pure Velvet. Okay.
Yeah, that's the one. That's the one a lot of people like.
Okay.
It's rather affordable, and it's bovine, grass-fed. Yeah. So that's what you want to look out.
And I think Katie put, if you're on Facebook, the link is under Katie's name, Katie Gegley. You could see her. She's with us every week. Shout out to Katie. You can that's the link to the Pure Velvet that we like. So thank you so much for asking about colostrum. We've been talking a lot about it for gut health over the last couple of weeks. So
I like colostrum.
Super interesting. All right, we're going to get to live comments, guys. We're going to get to every question tonight. If you have, that's interesting. She said Kelly's using Armra as well. Yeah. Okay.
Super cool. Kelly likes Armra.
Super cool. Thank you, Katie. We're taking questions here too, guys. If you have a question on Instagram, go ahead and put it in the comments there. We'll get to every single one. I believe Katie on YouTube asked a question, ivermectin question. Any thoughts on the Reddit/TikTok fad of using equine 1.87% ivermectin for rosacea? It's all over the internet as a $7.99 alternative to Soolantra. Doc, do you even know what TikTok is?
What is TikTok? Is that something Trump banned? banned TikTok?
No, we love TikTok's
TikTok's still
cool.
there.
TikTok's cool. It's still there.
Yeah, that's one of those kid things. I don't mess with TikTok. But, I don't care. I don't want anybody to see me dancing on TikTok for 30 seconds.
Nobody wants to
Is
watch
that what
you.
it is?
Nobody wants to watch you dance for 30 seconds.
Even me.
Although we do have a crowd who wants to see you play some guitar.
We may do that later on, not tonight.
We got to get warmed up.
Yeah, we got to get warmed up.
We're still early in the summer.
Yeah.
We'll bring out the summer jams. And we got Journey coming in Friday.
That's right.
The Journey cover band.
Mm-hmm.
You'll be inspired. King sport. All right, let's help Katie out.
Yeah, as a matter of fact, that's a good, interesting question because I have seen it used. Last week, I saw a lady in my office that had a terrible rash around her mouth. I ended up having to put her on oral steroids and also some 2% hydrocortisone and an emollient, special emollient. She had a terrible chafing, cracked rash all around her lower face. So I started asking questions. Anything nude, makeup, anything? She couldn't think of anything except for, I did have this new cream for my face for my rosacea, ivermectin cream.
No way.
Yeah, she said it really worked for it, but I don't know if that's what caused her mouth rash, but it's the only thing I could figure. So I'm not against you using it because she said it actually worked for her, and we use ivermectins for so many other things as well. But and I suspect for rosacea, even seborrheic dermatitis that you'll see in that same area on the face may have a component of either yeast, fungus, or perhaps parasitic, but I suspect more fungal. But yeah, I'm not against you using it. Just be careful if you break out like this lady did, because I really think that caused it.
And obviously, if you break out, you should stop it.
Yeah.
Okay.
Yeah. If it doesn't improve it, stop it. And, but yeah, I've heard reports of it working for rosacea, and medicines like cilantro are very expensive.
As an alternative to cilantro.
So Katie, I'm not against it at all. I just tell you one experience I have with a lady that took it.
Katie, does that help any? Let us know in the comments. That's super interesting. It worked, but you had a little bit of a, side effect.
I couldn't figure anything else that she had changed.
Let's see. Oh, Angela's in here. Angela, thank you so much for being in here.
Hey, Angela.
Angela is saying she's the derm expert.
Yeah, she is the derm person.
She's saying I prescribe it not only for rosacea but acne as well. So are you using the cilantro or the ivermectin? I'm assuming she's talking about ivermectin, the ivermectin cream that Katie was talking about. Thank you, Angela, for putting that in there.
That's awesome.
Yeah.
Yeah, Angela knows all about it.
Yeah.
So interesting.
Thank you for that comment, Angela. Thank you, Katie, for the question. I hope that helps a little bit. Let's see here. D. Len, welcome back. Thank you so much for being in here tonight. Let's see where we're at. If I can find a question here. Hopefully I'm not missing anybody. Let's get to Edna. Okay. Thank you, Edna. I recently started taking amino acids and they made me dizzy and have terrible pain in my legs. Is this normal?
It's not normal, not usual. Again, you can take any medicine or supplement and have a problem with it. So if you start feeling bad after taking anything, supplements are not immune to having side effects. I saw a report recently, I think it was today, on one of the news channels about warning against turmeric supplements. This lady had gone into liver failure because of turmeric supplements. I dug into it a little bit, and she was taking 2,200 milligrams of it, so way too much. And of course, when you take it with black pepper, it makes it that much more bioavailable. So, her liver function test shot way up, like 60 times normal, and it was from a supplement, from turmeric. So you can overdose on a lot of things, even a supplement. It's hard on a supplement to really overdose, but it can happen. Even vitamin D, you can get too much of it and precipitate kidney stones. And I always check liver function test. It's a dirt cheap blood test called a CMP, complete metabolic panel, when you get blood work. If you're on a bunch of supplements, every 6 months, just get a CBC and a CMP.
You know, it's interesting. You say that quite a bit, like the dose matters, you know, like the dose and adding one thing at a time with
The
supplements.
poison's in the dose.
Yeah, the poison's in the dose.
Sometimes.
That's right. And then does that help? Thank you for that question. Great question. So Angela's saying both this cilantro as well as the ivermectin. Thank you, Angela. Okay, thank you, Edna, for the question. We're going to keep moving. I see Loretta, Teresa, Barbara. What's going on, guys? Thank you all for being with us. Leanne, did you see the colostrum name? It is Armra was the one that my sister Kelly uses, and then the one you talked about and Katie mentioned in on Facebook is
Pure Velvet.
Pure Velvet. Pure Velvet. So let me know that you got that, Leanne. So you know the brand. Okay, let's see here where we're at. Hope I'm not missing anybody. Okay, you got and thank y'all for hanging out with us. These are such great questions. Lisa, thank you. My latest run of bad luck is Friday the 4th. I was going in front door of my home, lost balance, fell backwards, landed on my right side of the concrete porch, turned a backwards flip, and and threw me out in the yard. It hurts to even breathe. Lisa. Move my elbow, something in there moves. I was stupid and didn't go to the ER. Is there anything I can take or do to help me, please? So it seems like she might have broke something with this. If I'm reading this correctly, Lisa. It also says involve my pelvis and or hip. I'm not sure. So she does have an ortho appointment tomorrow.
Good. Yeah.
Okay.
Get some films.
Yeah.
Hope you didn't break anything, Lisa, but gosh, that's a run of bad luck.
Yes.
So sorry.
Yes.
Oh gosh. Hopefully nothing's broken.
But that's the right move. Ortho appointment tomorrow. Get some films.
Yep. Always ice things like that down and take it easy. If it hurts, it needs to be looked at.
Lisa, we're praying for you. We're thinking about you. Keep us posted. And next week, let me know how the appointment with ortho went. Terry's in here. Terry, I see you. I love you. South Carolina Peaches. Let's see here. And to stop taking the if I can remember that topic. I lost what Edna was talking about.
She was talking about taking the amino acids.
Okay.
Yeah.
Okay. So she did stop taking that.
Good. Stop taking it if it goes away. That's what it was.
All right. Let's keep moving. If you got a question for Doc, put in the comments. If you're new here, let us know. Thank y'all for hanging out. We do this every Tuesday, 7 to 8. We answer all your health and wellness questions. And I'm seeing where my next one is. Jay over there on YouTube. And I see you, Roel. I'll get to that after this. If I want to get a PRP shot, is it better to be off testosterone so the blood will not be as thick? So when they spin it, there will be more PRP. It's a good question.
I've never
that is an interesting
heard
question.
that question. I'll have to ask Jill if she notices a difference. My gut feeling is it wouldn't make any difference at all. I get PRP and I don't worry about it. So I wouldn't necessarily think if you want to if you're worried about it, you could certainly do it. If your blood does thicken up, but remember, they're just separate. They're just taking the platelet-rich plasma off of it. So when you look at it, it's almost like gold. It's not red, really. But I don't think it would make a big difference. But it is a very good question. I'll have to ask one of our centrifuge experts that. Yeah. So if I hear anything different, I wouldn't think it'd matter. But if you're worried about it, stop it for a couple of weeks and see. If your blood gets real thick, of course, you need to donate, which you may be doing. But I'll have to check. I don't think so. That's an interesting question. It's a great question, Jay. Thank you for bringing that up. We'll have to do a little more digging. Yeah. It's a great question. Thank you, Jay. I see Shelby's in here. Shelby, it's so good to see you today. Thank you for being here tonight. Yes, Jay, we'll look into that. That's cool. That's such a great question. All right. Roel was asking, is that ointment over the counter? I'm assuming this is colostrum. No, probably the ivermectin ointment. Oh, the ivermectin. I think you can get over the counter on Amazon. For rosacea. Okay. That's probably what you're talking about. So it is over the counter ivermectin. Roel confirmed. I think it is. Sounds like if it's $7.99, it's over the counter.
Let me make sure I can still. There we go. Okay. All right. Let's see here. Let me know, Roel, if that answers your question. I think you were talking about the ivermectin. All right. Let's go to Wayne here. Wayne, so good to see you. Hi, Doc. NAD plus and or 5-amino 1Q ever use or hear of its use, and what does it help with?
Yeah, of course. NAD plus is the newest rage hit, whatever. Really increases energy levels. It's a great product. Some people give it through subcutaneous shots. Some people give it through IV infusions. I've seen it done in both. It's just more of an energy and maybe a new longevity type drug. It really has a positive effect on mitochondria. 5-amino IQ or 1Q, I don't know. That's probably just an amino acid or a peptide. I'm not sure. Haven't used that one. But NAD plus is we've been using that for years.
Yep.
Very effective. It's hard. If you take it orally, it's
one MQ.
Okay, 1 MQ. Don't know it.
Okay.
If you take it orally, it's not as effective as it is through sub-Q or IV administration. The problem with IV administration has to be very slowly given over about at least 4 hours. So a lot of people don't want to do that because if you don't, you get this really heavy, kind of puffy feeling in your chest. So if you do get it really slowly.
I've heard we did an Explain This episode, Wayne, with Robin Riddle on NAD plus, and she did say like the delivery matters quite a bit, and especially with the IV drip and also with the dosing. Like you can get too much of it if you don't work your way up.
You can have a bad experience with it IV.
Yeah. Super interesting, Wayne.
But it is a new thing.
Yeah. Wayne, thank you so much. Let me know if that helps in the comments. Okay. Roel's talking about Bactroban.
Oh, that's a prescription.
Okay, so Bactroban's a prescription.
And don't get the cream, get the ointment.
Okay.
It does come in both.
Thank you, Roel. Thank you for letting us clarify that. It's the Bactroban ointment, and that is prescription. All right, let's keep moving here. I saw, let's see, Steve's question. There we go. Thank you, Steve. My rosacea is also in my irises, and my eyes are always red. Drops do nothing. Any ideas? What's your thoughts on this for Brother Steve?
I'd ask my ophthalmologist or optometrist and see what they think. I'm not sure how to treat. I've never treated rosacea in the eyes. I guess you could treat it systemically with some of the tetracycline type drugs, but I'm not sure you want to do that because there's a lot of GI problems with treatment with a lot of antibiotics. So interesting. Interesting. You might look at triggers. Some things trigger rosacea, like sunlight, stress, lack of sleep, maybe hormonal. So look at all those factors and ask your eye doctor about a drop for your eye, because I'm not sure, other than the routine stuff, if it would work or not, to be honest with you.
Steve, let me know if that helps, and we'll also do some more digging for you. Thank you for being here as always. I see my SD Bestie's in here. SD Bestie, what's going on? Great to see you. Thank you for being over there on Instagram with us tonight. We're taking questions here, so if y'all have questions, anybody have questions on Instagram, I'm looking at you guys as well. Thank y'all for being here. Okay, let's go to. I think, Debbie, I don't think I missed part of this. Let's see. Do you prefer berberine or GLP-1? And we'll talk about the microdosing of GLP-1s because I want to talk about that episode a little bit. But answer this for Debbie.
Of course, the GLP-1s are going to be a lot more potent. Berberine would be a good first step, especially if you're diabetic. It's not going to bottom your sugars out. If you're on insulin, you have to watch your sugars pretty closely. I did start somebody yesterday on one. It was a diabetic since age 8. And
GLP-1?
In addition to their insulin, we had to cut back on the insulin. I actually got Andy's input on it because he's kind of the diabetic expert, being a type 1. But so you might start out with just the berberine supplement, and then go. But I'm all for, even though it's off label for type 1, you still, of course, we can use it and use it quite a bit. My daughter loves it.
Debbie, thanks for that question. Let me know if that helps any, because that is a question we got. A lot of berberine versus GLP-1s. Real quick, for the people who haven't watched the episode, you talked about microdosing GLP-1s today on the Common Sense MD. I know you're microdosing tirzepatide, and you're doing it for longevity reasons.
And in inflammation reasons.
Would inflammation reasons also be longevity?
Of course.
Yeah. Okay. What was kind of the premise behind that episode? What prompted?
Well, you know, there's a lot of controversy about GLP-1s, and you know, we just had so much experience with them now that they're incredible drugs for treating diabetes as well as obesity. But a lot of people don't know the other amazing benefits, because I talk to my patients that I put on these, and they hurt less. They have improved sleep apnea off the bat even before they lose the weight. There's reports of less dementia, and certainly we know it can help reverse non-alcoholic fatty liver, and also protective of chronic renal disease, as well as many other reasons that we use it for, including longevity. So I've been microdosing a dose of tirzepatide, and here's an example on how low a dose I use, because I'm not diabetic and I'm not obese. I use, remember, the starting dose of tirzepatide, which the brand names are Mounjaro and Zepbound, just the starting low dose is 2.5 milligrams. I'm using 0.75 milligrams, not even 1.
Yeah.
And I think it helps you feel better. I really do.
Someone commented today, we put a post on Facebook about this, asking whether it helps with RA. Would it help with rheumatoid arthritis?
I had a patient yesterday that either has RA, I forget what they had, or lupus, or they have chronic pain. I'm pretty sure it's RA, because they're also on Humira, which wasn't acting. And they got on a GLP-1 for some other reason and got way better. And, you know, when you talk to patients, you learn to listen to them. And a lot of times they will tell you that they feel better on the GLP-1s, not only because they've lost the weight, but almost immediately they have less inflammation, less pain. And when I say immediately, I mean within 2 to 4 weeks, not an hour after you take the shot. It's a weekly shot, of course. But yeah, very interesting group of medicines. I prefer the GLP-1 GIP combinations.
Yeah.
So,
which is the tirzepatide, Mounjaro.
Yeah.
We had another comment around, will it stop working? So say I use it for, because I know you're a big believer in it being a maintenance medication. If I use it for 2 years, does it become less effective over time if you're microdosing?
You know, I recommend people take small breaks anyway before they develop tolerance. But the microdosing is so new.
Yeah.
I don't think it will, but this depends on how you feel. Sometimes I'll bump the dose up.
Yeah.
You could go to a regular dose of 2 or 2.5 even, which is still a very low dose.
That's interesting. A lot of strategy behind it. Thank you, guys. Thank you, Debbie, for that question, letting us talk a little bit about the GLP-1s as well as berberine. I hope that helps a little bit. She says she's taking berberine and loves it. Let's see, Teresa.
That's our best-selling supplement, isn't it?
Digest Shield, Super, and berberine.
Yeah.
Probably the top 3 right there. This is Teresa's comment. Helps with my joint pain, the GLP-1s, I'm assuming. I do feel better and helps with arthritis.
I love to hear these because it's absolutely true.
Yeah.
You know, the GLP-1s, and especially combined with the GIPs, have just turned out to be revolutionary. I think in my lifetime, that's definitely been the major drug discovery since I've been alive.
Yeah.
For 70 years. You know, of course, you got penicillin before I was born, and you had aspirin, but there's just a few medicines that are game changers, and then this is one of them. I predict almost everybody will be taking this in some form or fashion soon.
That's so wild. Do we have any more like success stories? Any stories around GLP-1s, GIPs, the tirzepatide, semaglutide? Anybody doing great on them? Let us know in the comments, because I know that can be encouraging for the community here. So put in the comments if you have one. All right, let's go. Let's see where I'm at, if I can find. Let's go to Leanne, and then I see Diane's question. Thank you, Diane. Can you please talk about red light in eyes? I wear goggles, but do I have to? We talked about that over the weekend, I think.
No, you don't have to. Now, if you combine it with the infrared light, some people say you need to, but technically, if you do the red light plus infrared, you probably ought to do it. It's because, even though this is not medical advice, that's what the rules say. But certainly with just the plain red light, you can look right into it, and it should improve your eyes. That's what I do.
It's interesting because I'm with Leanne. Like immediately when I see that red light, I'm like, oh no, not my eyes. And but it is. You've told me, like, actually, if you get the right type of red light, it helps you. It can help your eyes.
Yeah,
that's interesting. Leanne, I hope that helps a little bit. Thank you for the question. Okay, let's keep going here. If I can see where I'm at. If I miss anybody, put it at the end. I definitely don't want to miss any questions tonight. TT Warrior, I'm on Eliquis for next 3 months for a small blood clot in my lungs, which nobody knows how I got. Should I take any supplements?
Yeah, the one I really like when you get off the Eliquis. Again, when you're on Eliquis, you don't need to take any other blood thinner supplements, but the one you should get on, besides a baby aspirin, an 81 milligram aspirin, I'm really big on for a lot of different reasons, not only for prevention of blood clots, heart attacks, strokes, but also for at least a 30% reduction in colon cancer, maybe all GI cancer. So if you can take it, which very few people, it would be contraindicated from. I like 81 milligram aspirin. The other one, though, that you should think about after you get off the Eliquis is nattokinase. That's one we use a lot for. It's almost like a natural blood thinner. We use it a lot for long COVID patients, and we also use it it's part of the McCullough protocol for detoxing from the spike protocol if you got the vaccine. So.
Also, TT War, we did a dive into diet episode with our nutrition coach Lucas Schmidt on nattokinase, which is super interesting. So definitely check that out if you haven't. Great question. Anything else here for TT Warrior besides the nattokinase?
That'd be the best one.
Okay.
I don't know why you got a blood clot in your lungs. Some people, it usually comes from your legs. Maybe you're sedentary for a particular amount of time. I've had a couple of friends develop blood clots in their legs that went to their lungs from taking long plane flights. So make sure they check out your circulation thoroughly. And some people have a more tendency to have blood clots because they've got protein C, protein S, the MTHFR genotype. So there can be certain things that could predispose you to have blood clots that sometimes you'll want to get genetic testing for if you're really worried about it.
TT Warrior, I hope that helps a little bit. Let me know in the comments. Oh, there we go. They originally thought it was having a low-grade heart attack, but changed their mind after scan. Okay.
Yeah. They have a blood test called a D-dimer.
Yep.
That can help us look at that. Of course, we saw a lot of it with COVID, a lot of it with the vaccines as well. So blood clots we see a lot more blood clots. We see it a lot from the birth control pill as well.
TT Warrior, I hope that helps. Thank you so much for being with us tonight. I know you're here regularly, so thank you for being with us every Tuesday. I'm going to put this up real quick because I got a funny story. I agree, Connie Lynn. Digest Shield is amazing. And my funny story is, so now I actually live in the same neighborhood as Dad. And last night it was like 9:30.
This is a true story.
Yeah. It was like 9:30. and I realized that I was out of Digest Shield. And my wife and I, you would have thought like we didn't have clean water. We were like,
That's one thing you don't want to run out of.
No. So I called Dad. I said, hey, do you have any extra Digest Shield? And he did. So he actually brought it down to my house, which I was super thankful for. But that's my.
It is an amazing gut product.
It's amazing. So Connie Lynn, I agree. Thank you for that. I'm gonna put this up from Wayne. Huge success story here. Down 55 pounds, liver enzymes normal for the first time in years. A1C normal, all due to branded tirzepatide.
Congratulations.
That's incredible.
It works. It's a game changer.
That's incredible.
Congratulations.
Yes.
And here's one tip. Stay on it.
Mm.
This is a maintenance medication.
Yeah.
Stay on it. You can work your dose down if you want. And it's an amazing story, but we hear it every day.
Yeah.
It's amazing.
Thank you, Wayne, for that, man. Super congrats. Super proud of you, man. That's incredible. That is incredible. That's right, Katie and Carter. That is exactly right. I love it. Okay, I see Big Papa of 7 over here. I see Ventana. Ventana, so good to see you. I've been able to see you in
Italian, doesn't it?
It does have Ventana. Ventana sounds like Lavazza.
Kind of coffee.
Yeah.
Yeah.
Ventana, thank you so much for being here. Big Papa of 7 is asking, what are your thoughts on BPC 157 and methylene blue? And where would you recommend getting it from?
Take both of them. We have them on our store. Gosh, Katie, if she's on here, she can probably tell you the exact company, because you can also order it off Amazon. I think, I'm not sure about the BPC 157 if you can, but yeah, I take both of them. I'm huge on both of them. Just amazing supplements.
Yeah.
Those are Body Protection Complex 157, which is a peptide.
And are you talking about oral BPC or
oral?
Okay.
Yeah. Now you can take the shot too if you're injured, but it gets kind of expensive.
Yeah.
And I've used it for that into an injury, but you have to pop it in there via a subcutaneous shot daily for 30 days. Say you injure your knee, your ankle, your elbow. So, but I take the oral stuff, which is also very good for gut health as well. But I really like BPC 157 and methylene blue. Of course, I've done many episodes about it. It's just great for focus, energy, treating long COVID. Methylene blue is another awesome little product.
Big Papa 7, does that answer the injection question? And on our website, the capsule form of methylene blue is NeuroPro. So you can get it on our website. You can get it anywhere online. And I believe, gosh, Katie, I keep forgetting what the Amazon one is. BPH. Thank you, Katie. There we go. BPH methylene blue is the drops, and those are on Amazon. Okay, cool. Thank you. Thank you, Katie, for that. Let's go to, let's see. I saw one question that now I can't find. Maybe it was a success story. I'm going to put this up from Diane. I think I missed this. Binder or no binder with ivermectin? Do we have enough context there for Diane?
Yeah, I don't think you need a binder. Some people will combine it with fulvicin or one of those, or cholestyramine. I don't think you really need it.
Okay.
Some people, when COVID was going rampant and you had that cytokine storm, used a binder with it, but for all intents and purposes, I don't think you need to do that right now. Some people may disagree with me on that, but good question, though.
Yeah. Diane, thank you so much for that. I hope that helps a little bit.
If you have good gut health, you shouldn't need a binder.
Dave, what's going on, man? It's so good to see you. Hey to you back, Dave. So good to hear from you. Thank you for being here. Box 157, I'm assuming that's BPC. BPC 157 has been getting hard to find, especially USA based. You seeing this as well?
Well, all I know is I ran out of it this weekend and went down to my office, and I got the last bottle of it that I could.
Come on, man.
In the office, yeah. So I don't know, Katie. Is it hard to find now? We have it. I think we have it in all the offices. Katie could probably answer. she orders it. So I'm not sure.
That's interesting. Dave,
Probably,
yeah.
People hear about how great it is and they want it, especially if it's in an oral form. Most peptides I use in injectable, but this is one I really like the oral form of it as well.
Dave, thank you for the comment, man. I hope we can help you here in a bit, but it seems like you took the last one.
I know. Selfish, wasn't it?
This just shows how much you love it. It is funny. Like all the stuff that we talk about on this show, you do. Like if people were to look
most of it, yeah.
People were to.
I wouldn't do anything on a patient I wasn't willing to do myself.
Yep. Let's see. Thank you, Katie. We have oral BPC, but no injection. So we have the oral.
Yeah.
Okay.
The injectable peptides are kind of hard to get now.
Katie, thank you for that. So oral BPC, we're good on, no injection. We'll keep you guys posted on status of all that. Let's see. Thank you, Katie. Is integrative peptides for the oral. So Dave, I hope that helps, brother. Let's get to Lotto has a comment here. I'm loving methylene blue. I'm going to explore adding ascorbic acid. Yep. To see if it improves my energy. You talk a lot about that.
Yeah. You always need to take vitamin C if you take methylene blue.
Yep.
It makes it absorb better. And when we get the NeuroProtect Plus, which is the pill form of methylene blue that I now have switched to, it's just easier for me.
Yep.
It has vitamin C in it. So sometimes when I'll start people out on it, I'll start with 8 drops, go to 16. But the oral form has a vitamin C in it as well. But certainly if you do the drops, take your vitamin C with it, 1 gram.
I think the NeuroPro is what we're talking about, Lotto. I think it has 15 milligrams.
15
milligrams of C.
Oh, no.
More.
It's got to have more of C. I'm not sure how much C
Maybe 50?
in it. I recommend a
there.
gram of it. So I'll have to look at that. I don't know how much C is in combined with that.
Let's see. Thank you, Dave. Let's see. Cool Pill, Zach, Donna, Kathy. What's going on? Great to see you guys. Okay. TN Golfer. Red light therapy. Let's see if I missed your question. Can you put it in there again, TN Golfer, for me on Instagram? We'll get to your red light question. Okay, 75 of C. Ivy and JC with Ivy. Thank you. I love it. So 75 milligrams of C in the NeuroPro Plus.
You may want to take a little more than that. So, which I do anyway with the super.
You take 1,000. You take a gram as well with it. In addition.
Yeah.
Thank you, Ivy, for that. Thank you, Katie.
Thank you, Ivy. Hope you're feeling great.
Now let's see here if I missed the red light therapy question. Let's see if I can find it over here on Instagram. TN Golf, if you can put it back in there for me. For some reason, I'm not seeing it around a red light. Okay. I think we are up to date so far. If you have a question, we're going to be here for a few more minutes. Go ahead and put it in the comments, and we'll get to as soon as I see it. If I'm not missing it, if I've missed you, I apologize. Put it at the end, and I'll make sure I get it. Okay, here we go. Tennessee Golfer's just wanting to know what are the benefits of red light therapy. I'm sure we could spend the rest of the show on that.
Yeah, repair, energy. It's great for your skin, collagen, hair growth. It's good for acne. Gosh, it's just a healer type thing. Go to the podcast we did on it. I'll talk about it for 20 or 30 minutes probably, but mostly for repair, skin, and again, combined with the infrared, which penetrates deeper, it's very healing. I put it on my back every day. I put it on my face, and I stand in front of it. So there's a lot of red lights. Plus, it's in my infrared sauna.
This morning, I saw you with the red line on your back. I believe.
Then I got my infrared sauna as well.
Tennessee Golfer, if you go to our YouTube channel go to YouTube, search Red Light Report Performance Medicine, that video will show up. It's I don't think it's 20 minutes. It's got to be 15 minutes. He goes over everything around red light therapy, and hopefully that'll help a little bit. Big Papa of 7 is asking, can any red light work for red light therapy? And how would you use it for joints? So
Yeah.
it's a great question.
Just a single red light bulb is not going to do you very much good. You have to get a cluster of them that are together to get the intensity that you need. On ships, at night they use a red light. They
No,
don't
I
turn
did not.
any white lights on.
Really?
Yeah.
Red lights, like while the people on board sleep?
At night, because they're not visible from other ships. This, your cousin,
Yeah.
my niece, was
Yeah.
on a ship in the Navy a few years ago, and off in the Med,
Yeah.
off in the Gulf down there near Iran and some of those countries, and the only lights in the ship at night that are on are red light.
Interesting.
That's
cool.
They're not going to be therapeutic. It's just so they're not visible. Other ships can't see what you're doing. Enemy ships.
Does that help Big Papa 7 and T and Golfer? And we're gonna. How would you use it for joints? Is there a?
Yeah, I use it for joints. I just wrap I've got this flexible blanket that you've seen that I wrap around my knee if I have a sore knee from pickleball. And I just put it up along my spine. I also have a handheld device that's called the Red One that you actually got for me in Vegas.
Yeah.
He didn't pay for it. I did. $3,000. Thank you. That was back when they first came out many years ago.
He still uses it to this day.
It's more focal. And
Turns out to be a great purchase.
It's kind of like a red light laser for, really pinpointing. Like I use it on my thumb sometimes, which is the first place you get a little osteoarthritis. But red lights are great for joints, I think. But you have to get a cluster of them.
And T and Golfer, he typically Lumara is the brand.
I like Lumara.
Lumara.
There's a lot of good brands.
A lot of good brands, but Lumara is the one he uses. And then we got one from Whitney. Whitney, so good to see you. Eye sensitivity with red light. So another eye question. I had a handheld device and wore the goggles, but my eyes felt funny after, so I sent it back. Like for the people concerned with the eye stuff with red light, what do they need to make sure that they look for?
Well, after you look into a plain red light, which I think is safe if you read all the literature, after you look away, you're going to look like everything's red. So, but if you had an intense headache with it or eye pain, I don't know. You might want to ask your eye doctor about that, but you may not have given it enough time, especially if you use goggles with it, which you really don't need to do if it's just plain red light. But a handheld device, if you're talking about the red light laser that we use for pinpoint on joints, that may be a little. I wouldn't put that in my eye personally. It's too intense.
When also you talk about
focuses.
Like distance being about a foot away.
In general, if
foot?
you stand before one with a bank of red lights, but like that wrap I have,
yeah,
I just wrap it right around my joint. But it's certainly, if you had problems with it, don't use it.
Is there a type of infrared's okay with the eyes?
No, red light's okay with eyes. Infrared maybe not.
Infrared maybe not. Okay.
Yeah.
Winnie, does that help any? Because I know we've kind of danced around it. It seems safe. I'm with you guys. I think it is
a handheld pinpoint device that we use for, like sometimes pinpointing a joint might not be a great idea for the eye. So I think if you're using it to improve your eyesight, maybe help prevent macular degeneration, that type of thing, then you can stare into it. If it's just plain red light, you can actually stare into it. Don't need goggles, but stand about a foot back from it. That's what all the literature says.
Interesting.
I've done it. It didn't bother my eyes.
Whitney, I hope that helps a little bit. Thank you for that question. Let's get to this for Nikki, then I'll get to Damon. What do you think of GLP-1 microdosing for IBSD?
You can certainly try it. Microdosing, you're not likely to get constipation from it.
Yeah.
But, I would try it.
It does slow gastric emptying. Would that be any?
Yeah, but if the microdosing, it may not so much. But yeah, I mean, it'd be a good thing to try for IBSD.
Nikki, thank you for that topic. That's interesting. That had not come up yet.
Yeah,
that's interesting. Thank you.
Found a new use for it.
Damon is asking, can we order BPC 157 from you all without a visit? Doc, I'm going to get my labs. Damon, thanks for being here, man.
I think so, yeah. I guess Katie can answer that, but I don't see why not.
And Katie, if can you confirm with us for Damon here? Thank you, Damon, for the question there. Let's get to Linda. What collagen supplements do you recommend?
The one I use is called Keto Collagen, and I really like it. I put it in my coffee every morning. I love it. Do it every day. Usually drink 2 cups of coffee and put 1 scoop in each one. So it's keto, so it doesn't upset my intermittent fast, and it tastes kind of good too. And it kind of thickens my coffee up a little bit because I don't like just plain black coffee a whole lot.
Yeah.
So try the perfect keto collagen. We have it, I think, all our offices.
Thank you, Linda, for that question. Let's get to my brother Mark here. Thank you, Mark. Tennessee's Medical Ethics Defense Act was passed in April 2025. Why isn't a doctor's personal conscience enough to decide whether to perform a procedure or not? Why is this so controversial? It's a very interesting question. I wasn't aware of this, but I know this is something I know you love talking about. Like just being able to practice medicine the way you see as the best for the patient.
Yeah, that's the $1 million question. I don't know why. If a patient should have the right to not be treated, and a doctor should have the right to use his own personal conscience if he or she is not comfortable with that. So, yeah, I agree with you, Mark.
Mark, that's a great.
Why it's controversial? Everything's controversial now because it's so split. I mean, common sense doesn't rule the day. It's your side, my side. I don't care how right or wrong it is. It's, oh, your side says we're getting behind this, and the other side we'll get behind this. So a lot of times, just use common sense on things.
Yeah,
and people just don't do it. They get too riled up about this thing. We're all human. We're all trying to help each other out. Should be, at least. And it's just, of course, I don't understand why people hate each other,
But that's really, it's funny. Mark, thank you for bringing this up. That's what I really got out of the episode with Dr. Matuk. Dr. Matuk is like a real person, treating other people.
That's she's an oncologist.
Yeah.
She's been practicing for decades. It's wonderful. We got into a great discussion about some of this stuff, and being a doctor is really, there's a lot to it. It's not just science. There's an art to knowing not only how to treat somebody, but when to treat them, the psychology of treating them, the ethical issues, the morality. It all kind of plays a part in how you interact with a patient. And if you're not willing to do that, you shouldn't be a primary care doctor. Interesting. The highest burnout rates among doctor specialties
has to be primary care.
No.
ER?
Number 1 is ER.
ER. Okay.
Number 1 is ER. Number 2 is hospitalist.
So what do you think's behind that? Is it
number 3 is primary care. Primary
care is 3.
It's close behind. Yeah.
So
because of the stress of treating people.
Yeah.
And it's emotionally draining sometimes to treat patients for various things. Doesn't seem to bother Dr. Matuk, who's an oncologist treating cancer all day long. She's got them. That's why I really admire her and like her.
I do too.
If you haven't seen that, those 2 podcasts I did with her.
2 episodes with Dr. Matuk.
Really good.
Yeah.
It puts it in perspective. You always have to put things into perspective.
She makes it so human.
Yeah.
It was really cool.
She helps cure cancer. And then she has to help people die.
Yeah. Yeah.
So
y'all have to watch that episode. It was so good. Huge shout out to Dr. Matuk. Thank you for coming on the Common Sense MD. Okay. we're gonna call it an evening here. We're about out of time. I think I got to everything. Thank you, Katie, for this. For Damon, thank you guys.
Okay. Thank you. Yeah, you can get that without an appointment. So.
That's perfect. Thank you, Katie, for that. Damon, I hope that helps. Let's do real quick for intermittent fasting for Stacy. Intermittent fasting. There's a number of different ways.
Everybody can have different. Personally, what I do, most of the time, I don't eat after 7 p.m. until noon the next day. Black coffee, again, I do put the keto collagen in my coffee, but it doesn't seem to break my fast when I've checked it. You know, you can check your ketones as well, but it just kind of puts you in that ketogenic state for a little bit of time rather than doing it all the time, and which you have a lot of cellular repair, especially with your telomeres. And, you know, it kind of goes along with calorie restriction, which is a proven method to increase longevity.
Yeah. That's how I use it as calorie restriction, because I try not to eat before 12.
I think it's great. Now, whether you go a 16 off, 8 on, or an 8, or, you know, 18, 6, you can vary it a little bit. Some people do 20 and 4, 20 off, 4 on. You know, the guy I met, Brian Johnson.
Yeah.
That's what he does.
He does 4 on?
He does, actually, he's 1 meal a day.
So he's on 23 hours of the day. Sorry, off 24.
Well, not quite, but he literally doesn't eat a whole lot. Go to his episode. I had a chance to personally meet and talk with him a couple of weeks ago in Washington, D.C. And he's a very interesting guy.
He's an interesting
He's the most
dude.
tested human on the planet.
Yeah.
But he also spends $2 million a year on his own health. So
it does seem like he's coming from a good place, though. He's wanting, you know, our country to be as healthy as possible.
He's different for sure, but I enjoy talking to him.
All right, guys. Thank you, Stacy, for that. I hope that helps a little bit. We're going to call it an evening. Doc, have you tried the raspberry shaving cream?
Yes, I have. I love it. I love it. Mark, I shaved my legs with it last night. Just kidding.
Okay, guys, we love you. Tabitha, I see you. It was so good to see you today in the Geek Sport office. Thank you for being here tonight. I'm going to turn off this podcaster here. Let's see. All right. Thank you, guys. Carolyn, I see you. Thank you for being with us on Instagram. If you're just joining, I see Cole Meyer's daughter's just joining us. Rewatch the show. This was a great one. This was one of our better ones. How do we do, guys? How do we do? Give us 1 to 10 and be completely honest. We've got no dogs up here today, so we'll have to end with just Doc and I. How do you think we did?
Good.
I thought we did good.
You did good.
All right. Thank you, Cheryl. I love you. Thank you, Donna, for saying that. Dr. Matuk is the absolute best. All right, guys, we're going to get out of here. We do this every week. Tuesday, 7 to 8. Be back next week answering your health and wellness questions. I hope to see every single one of you there. All right. Let me see if I can find my outro.
Good night.
See you guys.
Don't go away.